Have you been told that your child has scoliosis in their spine? Wondering, is there anything you can do to help prevent their scoliosis from getting worse and perhaps even improve it? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to talk to you about scoliosis management and treatment. So here at My Favourite Physio, we see lots of children to help them with their gross motor skills. We see children who are typically developing as well as children with special needs. One of the things we do is we routinely check each child's spine to ensure that they're not developing a scoliosis. Scoliosis is where their spine starts to curve left to right, and it may happen simply because they had a growth spurt and it's idiopathic, meaning it comes on and it wasn't anything they did or didn't do. Sometimes scoliosis develop because of muscle imbalance, particularly in children with cerebral palsy who may have one side of the body affected more than the other. So it is really important to have regular spine checks to ensure a child's spine is developing well. Now, when we find that the child is developing a scoliosis, we would then determine, is this a flexible scoliosis or a rigid scoliosis? The treatment strategies would vary. Now, particularly in flexible scoliosis, it's because of muscle imbalance that can be effectively treated using a DMO suit like this one. So we customize these suits with specific rotations or panels to help correct their posture, pull them up straight so their muscles can start to work effectively and prevent the spine from twisting or turning one way or the other. If it is a rigid scoliosis, meaning it is the spine that's already a little bit rigid, however, if we catch it early, we can still get great benefit using these suits. We would also be using radial shockwave therapy to release all that muscle imbalance and tightness that will allow the spine to straighten up better and prevent it from constantly worsening with imbalance and pull. Depending on the age of the child, depending on the angle of the scoliosis, sometimes a child may require rigid bracing. So that bracing means a customized brace that will go around their trunk that they may have to wear for the next few years over their teenagers as they grow to prevent that spine from getting worse when they shoot up. And unfortunately, every now and then we see a child who comes in with very severe scoliosis who perhaps had not been monitored, and if the angles of their spine is curving more than 60 degrees or heading between 40 to 60 degrees rapidly, then unfortunately surgery is the way forward. And although it may be a major surgery that the child has to go through, it certainly is very effective and it helps keep them upright, preventing complications where there's rib cage might really twist and turn or crush forward, stopping their internal organs like their heart, stomach, and lungs from actually having enough space. So sometimes when the scoliosis has advanced beyond or is rapidly growing, then surgery is required. So to ensure that a child's journey throughout is well monitored and managed, we always ensure that a child is referred to scoliosis clinic at one of the major children's hospitals so that they're annually checked to monitor that growth spurts and to ensure that the spine isn't twisting too quickly, too rapidly, making sure we get the right strategies at the right time for the best outcomes for your child. So if you've got a child out there and you've been told about scoliosis, don't sit and wait and hope for it to get better. Really get in touch with an expert pediatric physiotherapist. If you would like to speak to one of our expert pediatric physiotherapists here at My Favourite Physio, the number to ring is 02-9790-4233. And if you know somebody out there who has a child who seems to be slouching one way more than the other, or they have been told that their child has scoliosis, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.